Hello and welcome to this People's Health revision video. Well done for keeping up your revision for this exam. Now, before we get started, make sure you've got rid of anything that might distract you. Make sure you're ready to actively revise. This video is going to think about one of our three key topics in the People's Health course, not living conditions or public health. We're going to be focusing here on the response to epidemics. And we're going to look at how this has changed throughout our four main time periods. Just quickly, let's have a recap of the names of these time periods and the key dates. So if you can just think in your head what the four key time periods are and the corresponding dates. We have, of course, medieval, Middle Ages first of all. And as I'm sure you are saying to yourself or even out loud, that goes 1250 to 1500. The next era is early modern, and the dates for that are another 250-year slot, so 1500 to 1750. We then have the slightly shorter, sharper industrial era of 1750 to 1900, and then of course since 1900 takes us from 1900 up towards the present day. So when we think about epidemics, when this kind of question comes up in an exam, there's three main areas that we are thinking about. Three main areas for you to check that you've revised and that you feel confident in. First of all, we need to know what happened. So for each of the different eras, what epidemics were there? What symptoms did those bring? How many people died, for example? We then have to think about how did authorities respond? What did they do? What did they tell people to do? How effective were their actions? And we also then want to think about how did normal people respond? And importantly, with each of these topics, we're thinking, how do these things change over time, or do they change? So how have the responses of government and normal people developed? So we'll think about each of these three questions for each of our four time periods. If we start then with the first one, the Black Death that struck Britain between 1348 and 1350, probably, well, almost certainly the most deadly epidemic the world has ever seen. Estimates suggest that around 40 to 60% of the whole population of the UK died through the Black Death. So we're talking here just astronomical numbers of people dying from this epidemic. Now, today, of course, we know that this disease, the bubonic plague, is carried by fleas. Those might have lived on the back of rats or in cloth, that kind of thing. But of course, back then, people had no idea. And the connection between fleas and this disease was not found out until a lot later. Classic symptoms would include buboes on the body and also high fever, and death would come quite quickly to most people that caught the Black Death. So those are some of our key facts. It spreads super quickly across the country and no one is able to stop it. No one is able to find a cure or an understanding really of what is going on, and it strikes people of all ages, of all levels of society. No one is able to escape the horrors of the Black Death. So how did normal people respond? Well, the first thing that we think about is they turned to God. In medieval Britain, most people understand the world through a religious lens. So if things are going well, it must be because you've pleased God. If things are going badly, it must be because God is angry. So that's the first main belief, that this terrible disease, this terrible, deadly epidemic is a kind of punishment from God. Alongside this, the understanding or the belief of how a disease might get inside your body is through miasma, mostly. So people believe in a kind of corrupted, evil, bad air, and if you breathe that in, that's how the disease gets inside of your body. Others also looked towards the four humours, which is how most people believed the body was made up at this point. And that was a way of trying to deal with many illnesses at this time. So if your humours were out of balance, you might need to let blood flow out of your body, for example, to try and rebalance how the body was working. So those are the kind of things that people believe was causing the disease. There were, of course, a whole range of other wild and wonderful ideas, earthquakes and stars in the wrong order, and crazy millipedes and insects in parts of the world, black snow, all these kind of ideas spread around, but no one had any idea really what was causing it. And that means that the way that people tried to cure it or to stop it spreading were ineffective. Of course, if you believe it's a punishment from God, then your first response to try and save yourself, to stop the spread, is going to be praying, lighting candles, going to churches, giving donations, all these kind of religious responses. To respond to miasma, you have to try to get rid of evil, bad-smelling air. So, for example, the use of herbs in people's houses would try to keep away bad smells. There were other attempted cures, for example, putting a live animal on a bubo, pigeon or something like that, frog. It might have made it feel better for a tiny while, but it's not going to deal with the illness, of course. And then we do have some people that try to avoid contact with others. Sometimes that's eye contact, sometimes that's just being in the same space as people that are ill. So although no one would have been able to explain, I suppose, or verbalize this idea of contagion as we know it today, there is this, I guess, understanding that disease can be spread from person to person, although that's a minimal and not so significant idea at this time. We do have some evidence of richer people running away, and as goes throughout this whole story of epidemics in Britain, in general, although not completely, richer people are more likely to be able to avoid some of the worst impacts of epidemics. So if we think just quickly about the authority responses to the Black Death, well, the key thing here to think about is that basically the response of authorities is pretty minimal. Certainly if we look towards the king and any kind of sense of national government, there's really no big actions taken which try to help the country, trying to help people across the country. And mainly that's because, well, there's just not really a national government like we have today. There's not really a parliament. There aren't really politicians or systems of government where someone or some people in the national government would be able to give orders and those would spread across the country. So it's not that they didn't care. It's not that King Edward III was a bad person that didn't care about people. It's just the system of government, the knowledge, and how these things worked were very different. So King Edward III, who's in charge at this time, he makes very, very limited orders. There are some instructions to clean the streets of London, and there's some instructions about national days of prayer and trying to encourage religious leaders to take control. But ultimately, nothing really has been done of any meaningful action. But this time, main authorities really that most people will look up to are church leaders, people leading monasteries, that kind of thing. And so, of course, their main response was encouraging a religious response, praying, donating, lighting candles, as we've just been discussing. So that is a summary of the Black Death, and we'll now move on to look at what happens in early modern Britain. Now, unlike with medieval Britain, we don't have one major event like the Black Death. Instead, when we think about early modern Britain, we're thinking about the plague, which is the same disease, has the same symptoms as what the Black Death was, the bubonic plague. But unlike the Black Death that we focus on in medieval Britain, we're thinking here more about this a kind of epidemic which just keeps on returning. It returned roughly every kind of 20 years or so. Now, it was never as bad as what happened in the Black Death, and we start to see it more appearing in towns and then dying out quicker rather than spreading across the whole country, as we saw back in medieval times. Now, having said all of that, it's important that we have one main example that we can mention in an exam if this comes up. So the Great Plague of London in 1665 was the worst example of a plague in these times. Around 20% of the city died, that's 100,000 people. And so that's our are one key example, but we're thinking about something which lasted much longer and kept on coming back and returning. Now, if we think about the authority responses, well, this is something that really changes from medieval to early modern times. We've just been thinking about how in medieval times there was very, very little action taken by any kind of national authority to try to deal with the disease. That changes massively in early modern times. It's really important we can think of some examples and we can explain how this is a different experience for people. That doesn't mean the national government solves everything, but they do try to do a lot more than what we saw previously. So the first major orders come under the leadership of Henry VIII in 1518. He starts to introduce national responses of quarantine, of isolation for plague victims. And then over time, future subsequent kings and queens and leaders take on and build on those measures. So Elizabeth I, later on in the 16th century, introduces a whole range of orders which the country is meant to follow. At this time, the ability of national governments to do this is made easier by the printing press. So, for example, when Elizabeth I makes new orders, posters, leaflets, booklets can be printed quite quickly, quite cheaply, can be transported easily across the country. So it's much easier in the early modern times to give these orders that spread around, particularly if we compare that to what was going on in the medieval times. So a quick summary then of three major moments here in terms of national authority responses. We have the Royal Proclamation of Henry VIII in 1518. That's all about isolation and quarantine, trying to stop the movement of people. It doesn't understand necessarily the cause of the disease. That's still to be discovered, but it does understand that if you stop people moving, if you stop the movement of a disease, that's going to limit how far it spreads. So not completely effective, but it's progress. As we move forward, we look at the plague orders that came under Elizabeth I. These build on the idea of isolation and quarantine, but we now have a much larger range of orders. Some examples: cleaning streets, burning barrels of tar to get rid of miasma, much stricter locking up of infected houses. We see here some orders which kind of make sense, which kind of do help in some ways. For example, the cleaner a street is, the less likely a disease is going to spread. There are others, though, like burning tar to get rid of miasma, which show that despite the government trying to do more, the lack of scientific understanding is still holding back the effectiveness. And then the third example here we have a series of plague acts in 1604 under the King James I. Here we have the government trying to make it easier to follow the laws of isolation and quarantine, so a better system of collecting money for the sick to allow them to stay inside for so long. But we also see harsher punishments for breaking isolation. And in this we see how the changing kind of nature of the country, the greater control that kings and queens and national authorities have over people are allowing for a more detailed set of orders, set of laws. So big changes in terms of the way that the national government is responding here. Important that we also think about local responses. So in this time, it's not just what the national government is doing, but different towns, different areas are doing their own thing. And these have very different levels of success, depending on the focus of the local authority, and also depending on how organized, perhaps how wealthy they are. So what kind of things did they do? Well, we have things like following the national orders and then developing their own systems, so ways of isolating the sick in a particular town. We have many towns that build pest houses on the outskirts, so that's places where anyone with the plague can be taken and isolated outside of the city. If we look at one example of Cambridge, so one city in 1665, we see an example of a town which is really organised and makes a lot of quite sensible actions that do help in some ways. So in 1665, the aldermen of Cambridge lead their local response, and this includes things like only allowing strangers into town with a health certificate, includes hiring and organising a series of searchers who are there to check who has the disease, to make sure they're isolating, to try and search for people who aren't following the laws. So we can see here that local and national governments are both having a much greater impact compared to medieval times, and some things they're doing are going to work. Some things, of course, that people didn't work. Famously, we have the mayor of London ordering for cats and dogs to be killed across the city during the Great Plague, which of course had nothing really to do with the spread of the disease. So it's a kind of a mixed idea we have here. On the one hand, government is doing a lot more, they are trying a lot more, but their levels of understanding are going to limit the effectiveness of those actions. And then finally, for early modern times, if we think about how normal people responded to the plague, again, it's a bit of a mixed picture. On the one hand, we have a religious response. We have people believing in miasma still. But if you remember the story of that village, Ely, where people basically closed off the village and refused to leave, and refused to allow people to come in to try and stop the spread of the disease, we see a community which is understanding contagion a bit more, understanding the spread of diseases, and nothing like this kind of happened in medieval times. So let's have a quick summary then of what people thought caused the disease. Well, there is this growing understanding of contagion. There is efforts that people make to try to not meet, not touch people, not be near people that are ill. And there's a growing kind of look towards medicine and cures. So in terms of how people react, we'll see in a moment. Also, though, we do have this quite stubborn belief in God being the central kind of issue when it comes to what's causing diseases, and miasma as well remains a core belief. So in terms of how people react, well, there are some things which are changing compared to medieval times. We have much more people who are kind of running away, particularly richer people, avoid towns where the plague is striking. We have much more evidence of people trying to avoid contact, and many more attempted medical cures. We see a whole growth of plague doctors and richer people paying for cures and for help. Most of those don't work, but it is a kind of slight change in the way that people are responding. There are some things, though, which are staying the same. So if we compare to medieval times, well, people pray, people deal with miasma. How they deal with it slightly differently, or things are changing. There's burning of tar. We have people smoking to try to clean the air around them. But overall, the main belief there is quite similar to what happened in medieval times. Okay, so we'll move on now to what goes on in industrial Britain, and our key epidemic is cholera. There are a whole range of epidemics which spread throughout industrial towns and cities, many of them, or most of them, linked to the terrible living conditions which so many people experienced. But we're going to focus on cholera here, and cholera first comes to Britain in 1831. It had been spreading across other parts of the world. People knew it was kind of on its way, but didn't really know what was causing it or how to stop it. And in that first main year, 1832, it has its most deadly impact on the country. So in that first year, 32,000 people are killed, and it wreaks havoc across towns and cities all over the country. There are then multiple outbreaks up until the 1860s, but as understanding grows over time, these outbreaks are much less severe, and they get better and better in terms of the way that people are able to respond to them. We know, of course, now that cholera is caused by contaminated water, so water that has human waste of people who are suffering from cholera, and so that was particularly bad for industrial towns where water might be taken, drinking water might be taken from sources which are, which have human waste in them. Main symptoms are vomiting, diarrhea, dehydration, skin turning blue, and quite a quick death for people, particularly weaker people. And we know that people living in these towns and cities often were suffering from malnutrition, from other things which would make them less able to deal with a disease like this. In terms of how authorities respond, well, we can see just from this poster, from this kind of leaflet, that the governments and local authorities, they are in a relatively good position to be able to respond to something. And there are the kind of the systems in place to try to deal with things. Now, having said that, we see mostly local boards of health kind of taking control of the situation. So, for example, in the city of Leeds, it was very badly affected in 1832. We have Dr. Baker, the kind of medical officer, who is leading the response of the town. In terms of what they are doing, the authorities, well, what we see is, I guess, a more kind of research, scientific-led approach. So lots of mapping of where the cases are, trying to work out who is affected, when they've been affected, trying to make sense of it all. And then a much quicker ability to get advice out to people in newspapers and posters, and reporting back to central governments, to other countries even, trying to share what's happening. So we do see changes here compared to previous eras. Having said that, in terms of the national government, well, we do have this issue that the prevailing attitude is one of a kind of laissez-faire approach, where the national government doesn't really believe it's responsibility or its role to get involved in day-to-day issues. And that attitude, as well as a lack of scientific understanding, means that when cholera first strikes in Britain, the government response is largely ineffective. However, over time, thanks to people like Chadwick and John Snow, as well as due to a changing attitude and the government no longer being able to kind of ignore the severity of the problems, things do improve over time. So as we go through from the 1830s up to the 1860s, governments, both national and local, are taking much greater, quicker, and ultimately more effective action. In terms of the responses of normal people, well, this is a kind of interesting time. Industrial Britain is a time of rapid changes, and quick, important, significant changes in all aspects: living conditions, epidemics, public health. And we see when cholera first strikes that people still have beliefs which are pretty similar to early modern, even medieval times. Belief about things being a punishment from God, beliefs about miasma. But interestingly here, we see quite quick and rapid changes. At the start, normal people, particularly some of the poorest communities living in industrial towns, have this sense of distrust about the government. So when advice comes out or cholera victims are taken to hospitals, we do see this rise in protests and dissatisfaction of what the government is doing, and even some kind of rumours about a plan, a kind of conspiracy to damage poor communities. So that is there at the start in the 1830s. However, over time, and this happens relatively quickly, scientific responses, this understanding of the science, of believing, of trusting the government, of following advice, does happen relatively quickly. So we see normal people moving away from a belief in religion, a belief in a kind of a cause of just purely religious input, to this belief more in science and belief more in what the government is trying to do. So quite quick changes, and changes more from what we would kind of expect today. Just quickly, important to mention Louis Pasteur, who in 1861 discovered or brought out his germ theory. And this really discovered the link between germs and diseases, and it led to vaccinations, it led to much quicker responses. So here we see science, scientific developments allowing governments, allowing authorities to be more effective in their responses. And that's going to make a big impact as we move into the 1900s and Britain since 1900. So we have a much higher level of scientific understanding. That doesn't mean that epidemics don't strike. And we actually have two that we are going to look at in Britain since 1900. The first one is, of course, the Spanish flu, which comes to Britain in 1918 and 1919, just as World War I is ending. And this is a brutal epidemic that kills large numbers of people very quickly. So around 228,000 people are killed in a short amount of time over the winter of 1918 to 1919. Symptoms, common symptoms, well, they started off seeming like a kind of normal cold, and that would be the extent of the illness for many people. However, others would then develop these more serious symptoms. So bleeding from the nose and ears, a very high fever temperature, and then the development of kind of blue patches or dark spots on the cheeks. And strangely enough, this epidemic, this disease, hit kind of young adults the worst. And many would die very quickly having contracted the illness. Although authorities and science didn't understand exactly what was causing it or able to completely stop it, the responses are much more effective in terms of the ability to stop the spread of a disease. Now, when we think specifically about authority responses, the government is trying to help, although the government is involved in the war and then the aftermath of the war. So the national government isn't the most significant player here in terms of authority responses. In fact, instead it kind of falls on local boards of health. Since the 1875 Public Health Act, all towns had had a board of health and they'd all had a medical officer. And so these are the people that lead the response to the Spanish flu. Now, importantly, that means if you've got a local response rather than a national response, that some places are going to be able to respond more effectively than others. So a positive story is what happened in Manchester, led by Dr. Niven. This is probably where the town was most organised and where the leader, the medical officer, had the best ideas. So in Manchester, we have very detailed records taken, scientific investigations get taken very quickly, get taken forward. We have orders quickly to wear face masks in public, orders to limit contact between people. That includes closing down things like factories and schools, and very good advice given, very quick advice given, whether that be on leaflets and newspapers, in public addresses. So this sort of thing means that a town is able to limit the impact of the disease. It can't stop it, but it is able to limit how bad the disease, the epidemic, hits a place like Manchester. That being said, there were people in our authority that tried to stop these kind of orders. So people that owned businesses, people that distrusted doctors and science would try to stop the closing of factories, for example, or might question some of the orders to wear face masks. In terms of normal people's responses, well, unlike previous eras, there is now a trust in science. There's a trust in what the government and authorities are telling people to do. So we see people wearing masks. We see most people following the orders to limit contact, to not go into work, to not go to school, that kind of thing. Of course, there were people who wanted to get around those rules, whether because they didn't believe them or because of a financial necessity. We have, of course, people that are breaking them. But in general, people respond to what the government says. There is less kind of superstition or a religious response than we had previously. We see here a picture of a more intricate, slightly stranger breathing device. And these sorts of things sometimes would have been effective, more able for richer people to access, and wealthier people are more likely to be able to either leave places where the disease is spreading quickly, or more able not to go into work or to live in neighborhoods with fewer people around. So in general, wealthy people are able to avoid the disease more than people living in built-up environments in cities. We'll move on now to our final epidemic, AIDS and HIV. So this comes to Britain in the 1970s and 1980s. AIDS is actually the condition, and that is caused by HIV. And it took a while for scientists to understand exactly what was going on here. And that's probably led to some of the confusion between the two terms. But we can talk about AIDS as the condition caused by HIV, which is the virus. Now, quite quickly, scientists discovered that this was spread just through blood or bodily fluids. Most common symptoms would be pneumonia, a rapid weight loss, and sores on skin. And it was quite deadly when it first came into Britain in the 1980s. Thousands of people die. But over time, and relatively quickly here, the medical developments allow better treatment to limit the kind of mortality rates for people affected. Now, what's interesting or important about AIDS is it arrives at a time when the country, of course, is very different to how it was in previous eras, even to what Britain was like during the Spanish flu. And that means that the responses of governments and the responses of normal people are going to be very different. They have different factors, different things that can impact how they respond. If we think about how authorities respond, well, at the start, the government doesn't really take strong enough action. It is slow in its response, and it is impacted by the kind of the rumours or the myths about the disease. It's perhaps not as strong a response as would have been hoped for. In fact, at times the government actually increases the kind of fears that people have. So the government orders, for example, doctors and visitors who are with patients to wear gowns and masks. That's even though the science was getting pretty clear that it wasn't spread by contact, it was spread by blood. Despite that, things the government do towards the start of this epidemic don't help to reassure people or clarify what is going on. That changes, though, in the middle of the 1980s. And from 1986 onwards, there's a much better response. We see, for example, publicity campaigns, including sending information to all households would respond to this AIDS Don't Die of Ignorance information campaign. And this is a much more organized system, much more effective system of bringing out information that had been possible at any previous time. And this really does start to help change the attitudes of the general population and make them better informed about how to keep themselves safe. We then see the governments and authorities being helped by medical and scientific breakthroughs to be able to help the general population. And so, although some of this is just medical and scientific work across the world, the British government is funding research and does fund access to treatments and to medicines, which really helps people who have contracted the virus. Lastly, then, in terms of how normal people responded, well, it's important we think here that things change a lot over quite a short amount of time. When AIDS first appears, it is connected with a whole range of very horrible, very dangerous myths, rumours, fake news, we might say, alarmist media, which makes people panic, it makes people concerned, it makes people distrustful, and there's quite a lot of homophobia that goes along with some of the rumours about the disease. But over time, this does change. One of the significant things is the actions of celebrities, people that the nation trusts and sees them and knows them from TV and from other media. So Diana, Princess of Wales, when she shakes the hands of an AIDS victim, very important, significant moments. Celebrities like Freddie Mercury, who sadly died from AIDS, are able to bring more awareness, understanding, and acceptance. And alongside that, education improves. people a better understanding through government information, through TV shows like EastEnders that had a character with AIDS. People are much more educated, much more able to deal sensibly with this. And so people have a developed understanding, acceptance, and also with changes of medicine, we have an interesting development where actually people have become a bit complacent over time. So as the medicine has improved, making AIDS less fatal, actually in some ways people have become more complacent in keeping themselves safe. So a whole different range of new issues, media, celebrities, new medicine, scientific work has meant that responses to AIDS have been very different compared to responses to other epidemics. So that brings us to an end of looking at epidemics here. Let's have a quick look at the kind of questions you could get asked. So you could get asked a 1-mark question of give an example of either a symptom, give an example of a government response, give an example of a way people tried to stop the spread of the disease, or of a way people attempted to cure a disease. So you could get asked any of those things for any of the epidemics. You could get asked to write a clear and organized summary. Now, that might ask you about any of the epidemics. So it could simply be write a clear and organized summary that analyzes the Spanish flu epidemic, or it might be more specific. For example, how did authorities respond to the plague in early modern Britain? So there, it's really asking you to focus not on the overall plague, to focus on authorities, how they responded. Why questions are going to get you to be able to really explain why actions or attempts to stop the plague were effective or were not effective, or the kind of things that impacted them. So this example of a question asks why attempts to stop the plague were limited in their effectiveness. It might ask you, why did responses to the AIDS epidemic change between 1980 and 1900? Remember, in this question, we're really having to explain something. So be careful not to describe, in this question, for example, try not to describe how responses changed, but to think more about why they changed, what was impacting people's responses. And then finally, of course, you could get asked an essay question where you're going to be asked to compare 2 of the eras, at least 2 of the eras. So this question says, how far do you agree that government responses to the Spanish flu were much more effective than government responses to the cholera epidemics? So we're comparing Spanish flu of 1918-19 to cholera in industrial times. And what we're being asked to think about here is government responses. So we're having to judge whether we think they were more effective, less effective, or pretty similar. So those are the sorts of questions you could get asked. There is a run through of all of the epidemics in this course. Good luck with the rest of your revision, and remember to ask any questions you've got. And you could do now a plan for some of these questions, or you could do your own note-taking based on what we've been watching.